Hi, I'm Dr. Melissa Kerr. I'm an integrative physical therapist, and I'd like to talk with you today about managing stress during COVID 19, particularly as it affects nurses. And in my experience, although I am not a nurse, I do have a family member, my niece, who is a nursing student, and she comes from a family of nurses. And she right now has shared with me her experience as a student dealing with nursing challenges, with her education possibly being put on hold. And while in school, she's also working in a critical care unit at Mercy and is dealing in the worst of the worst situations, like many of you are facing COVID. She has had COVID, she has survived COVID, and she is back working and undergoing her studies, which have transitioned to uncharted territory with everything being online. So, although I'm not a nurse, I'd like to speak to you today as a healthcare professional trying to navigate these uncharted territories. So, what do we know about nursing? We know that there are some superpower qualities in this profession, and three of those qualities relate to being incredibly compassionate, incredibly caring, and having really strong communication skills, which is such an asset because you are dealing every day with breaking down very complicated information into bite-sized nuggets for our patients to be able to better understand what is going on. You may need a reminder to look back at why you got into this profession. Most people don't just pick nursing because that's what they figured they would do. There's a calling. There is a deep-rooted desire to help people. So sometimes in situations where we're struggling, where we're very highly stressed, more than normal, we need to reflect for a moment on our purpose, the meaning in our work, and remember to look for the gratitudes. So, finding joy in your job, even in moments where you can't possibly fathom finding something uplifting, we need to look for that in the darkest times. So, the usual stressors in healthcare, and the usual stressors in this case with nursing, are the inefficient work processes, which is a very large umbrella. There's a lot of inefficiencies in healthcare, and you know it, you live it, you feel it. Staffing challenges, there's never enough staff. Difficult patients, someone is always ready to read you the riot act. Sometimes our colleagues at work are challenging and test us. And there's often the overworked and underpaid feelings. So before COVID, the statistics show us that nurses suffer from depression at twice the rate of other healthcare professionals. About half of US nurses experience suboptimal physical and mental health. And the long hours, the work overload, and the shift work are common reasons for job dissatisfaction and stress. And this can be linked to burnout and health consequences such as obesity and sleep disturbances. So when you take the pre-COVID and what we consider to be the usual suspect with what causes us stress, and then you add these additional COVID stressors on top of it, we start to come together with the perfect storm. So take everything I just mentioned times 100, less staff and less equipment. And then we look at a higher volume of seriously critically ill patients, likely infectious patients that are isolated from their family. There is the fear of you going home and infecting your loved ones, your family, your friends. You're more isolated from your family and your friends and from your coworkers. You're juggling life in a pandemic outside of work. For some of us with children, we're looking at what do I do with childcare, remote learning, being a school teacher on top of a nurse. And then there's the day-to-day things that change as orders come in differently every day from our governors. And we live on a state border, so some of us may be crossing the state lines and have different rules and regulations to be aware of. You're constantly exposed to COVID. You're constantly worried about your personal health and your job duties. And that can lead to having feelings of loss, of grief, of fear. When you can't give the care that you strive to give each and every patient, it can create quite a challenge. It will worsen the underlying state of self, personally and professionally. So we've all heard of burnout, and the question is, have you heard of compassion fatigue? What's the difference? Does it matter? So burnout is workload stress, and I'm sure we've all had some brush with burnout at some prior time, and now at an even maybe more alarming rate. Compassion fatigue is a secondary stress. It's from exposure to suffering, and it's unique to those in the caring professions. If you don't address compassion fatigue, it can lead to burnout. Compassion fatigue has moral injuries, distress, and even the impact of patient stories that go along with it. You all learn to know who your patients are. The longer you spend with them, the more you start to understand where they came from, or if they're funny, what their family might be like. So, working in a pandemic, living through what you are, seeing the sickness and the illness and having the fear that you're having, more than anything, I believe you need to be validated. The research says we need validation. We need support. You need to be reminded that what you are feeling is normal and what you are feeling is valid. You are not alone. So let's try not to further isolate ourselves. We might need to get back to our roots. We might need to reflect back on, where is your joy? What was it that brought you into this profession? Can we be mindful? Can we be in the moment? When we look to the future, we tend to be dealing with anxiety. When we're dwelling on the past, we're looking at depression. But if we can just balance those by being in the moment and understanding that with being in the moment comes a lot of acceptance of impermanence. You may not know what the next moment is going to bring, so let's not focus on that, but focus on where you are right here and right now. You need to use the tools, and sometimes that's what your employer provides you with. Is there a hotline that you can call? Is there counseling or staffing that you can reach out to, because you need validation? And can you learn new tools? And that's a challenge when we already have so many stressors going on. Can we learn new tools? Ultimately, we have to come back to doing the best that we can in the given moment. Your best in this moment is good enough. And with that, we have to have compassion and we have to have grace for ourselves. So, can you ask yourself, if there's a particular moment you're dwelling on or you're unable to let go of, can we look at what has gone right in the moment? And what did I do really well? We're often so trained to critique, which is different than criticizing. And sometimes we criticize more than we critique. But can we look constructively at a situation, but maybe assess for what went well? Can we look at creating a mental first aid kit? So think about that for a minute, a mental first aid kit. When we look at this, we're shifting us from feelings of permission, rejection, frustration. We're looking at maybe putting into our first aid kit the reminders of things that bring us joy. Maybe we have physical or digital photos. Maybe there's music or mementos, or maybe there's a thank you card or words of wisdom from a patient or a mentor. Can we put that in a space where we can reflect on when we're feeling overwhelmed? And can we create a buddy system? Can we create a partner to remind us to pull out our mental first aid kit and use it? So let's consider what the evidence suggests we should do when we're feeling highly stressed, overwhelmed, overworked, maybe even hopeless. Well, meditation, right? How can we apply meditation at work? Well, we can apply meditation or mantra use through maybe when we're washing our hands instead of letting the stress get the best of us, maybe repeating to ourselves instead of singing the happy birthday song or counting to 20, maybe repeating a phrase such as, I am safe, I am secure, I am protected, I am loved. So think about that for a moment. Washing your hands and repeating, I am safe, I am secure, I am protected, I am loved. The research also points us to a mind body medicine technique of soft belly breath. We know that when we breathe, we can start to regulate our autonomic nervous system. We know that we can start to pull ourselves down from a fight or flight sympathetic overdrive with slow, soft breaths, and we can come into parasympathetic dominance. We can activate our relaxation response. So, without getting too complicated, soft belly breathing is inhaling, thinking, or saying the word soft, and exhaling, thinking or saying the word belly, all while we allow just the lower abdominal region to expand on the breath in and release on the breath out. We can look to paced breathing. Paced breathing is another technique that helps us activate our relaxation part of our nervous system. So we focus on extending the exhale. So we might be counting our inhale, and if it's a 2 count or a 4 count, we want our exhale to be longer than that, maybe even twice as long. And we can look at contemplative movement like Tai Chi or Qigong or yoga, and that might be great in theory, but that might not be incredibly applicable when we have small micro moments at work to be trying to apply some of these self-care and de-stressing strategies or tools from our toolbox. So let's take a look at tapping. Let's take a look at the emotional freedom technique. If you're familiar with this, let's go through it together. If you've heard of it but not done it, or if you've never heard it before, this is going to be my suggestion for you to consider utilizing it in the workspace, maybe utilizing it at home. So emotional freedom technique and tapping starts to utilize the concepts and theories of traditional Chinese medicine. We're trying to open acupoints. We are trying to restore a better balance in the flow of our qi, in our energies, in our breath, in our prana, however we choose to term it. And we're looking at this phrase that's listed on the slide: the cause of all negative emotions is a disruption in the body's energy system. So these are the points we're going to tap. You don't have to memorize the names. You don't have to memorize the abbreviations. We just need to know that there's an order that we will follow. The hand point over here, the KC, stands for karate chop. So if you could imagine where you would karate chop something, it would probably be where you strike on the pinky side portion of the hand. So we have to just be general with this. So find this point on one of your hands and maybe take 2 fingers and just start to tap on it very lightly. Doesn't need to be heavy. So we will end up tapping on this point while doing a series of other things. And then we will go to the top of the head, TOH. So coming to the top of the head, this is a governor vessel point. We'll tap here. You can use either hand. You could use 2 or 3 fingers. And then we're going to come down to the eyebrow. So the inner eyebrow point. Doesn't matter which side. You could do right and then left. You could just do right. You could just do left. You can cross the body or stay on the same side. Any or all is good. You could even do both sides at the same time. After the inner eyebrow, we're going to the side of the eye. You could consider it like the outer eyebrow, but we're on the bone in line with the corner of the eye. We're tapping here, maybe one side, maybe both. And then we're going under the eye. We're going about an inch underneath the center of the eye. We're tapping here. From here, we come to the space between the nose and the upper lip. We'll tap here, maybe with just one finger. And then we'll go between the bottom lip and the chin and tap right in the center. We'll move down to the next point, which is the inner collarbone, right where the collarbone meets the sternum, the breastbone. We'll tap here. And then our last point is below the armpit, about the width of your four fingers below, but on the ribs. So we will tap right here. And then we'll release. So these are the points: karate chop point, top of head, inner eyebrow, side of eye, under eye, between the nose and the upper lip, between the bottom lip and the chin, down to the inner collarbone, and then on the ribs, below the armpit, about the width of your four fingers. These are our tapping points. There are tips to the tapping. You'll use either 1, 2, or 3 fingers. Moderate pressure, doesn't need to be super light, it doesn't need to be super heavy. You could tap one side or both sides, as I have said. It doesn't have to be evened out when we do this, and you don't need to count the taps. You'll find that you're just going to tap enough to cover the phrase that you'll be repeating. There's 5 steps. We identify the issue, we test the initial intensity, we look at the setup, the sequence, and then we retest the intensity. So identifying the issue, you're going to stay focused on one problem. And we're intentionally choosing a negative thought or a negative emotion. There is a lot of science behind this. So without getting into it too deeply, we are choosing words that say, what is my one problem right now? And it's just one problem, not 7 or 10 all at once, but just one. What's bothering you? Is it I am anxious in this moment? Is it I am afraid? Is it I have a sore shoulder or I have an aching back? Am I overwhelmed? So pick one thing, and that's your issue. Then you're going to take that issue and you're going to ask yourself on a scale of 0 to 10 right now, how intense am I feeling about this issue? So if I choose my anxiety, how intense is my anxiety right now? And I could get specific and I could say, what is I'm anxious about this particular patient or going to work tonight or bringing home some illness to my family. So my anxiety about my job right now is a 9 out of 10. I've just selected it. That's how intense I'm feeling in this example. So if you have an emotional issue, you might recreate the memories in your mind and assess how much of a discomfort you have. If it's a physical ailment, you can assess the pain like you would ask a patient a 0 to 10 pain scale. If it's a performance issue, you can attempt the desired performance level and measure how close you come to it. So you're assessing yourself on a scale of 0 to 10. And then the setup. So design a simple phrase and you'll repeat it while you're tapping. So you're going to acknowledge the problem and then you're going to accept yourself in spite of it. So an example would be, even though I have this anxiety about work, I deeply and completely accept myself. You can change the wording to this. You can probably Google all kinds of phrases for emotional freedom technique or tapping. You can create one, but you want to recognize that the issue or the problem that you've identified, and then you need to accept yourself. So then we follow the sequence, and we've gone through the sequence, and eventually the more you do this, you'll have it memorized. So you start on your karate chop point. You will tap here just enough to repeat the phrase. And for some of us, we might want to repeat the entire phrase, right? So if we go back to, even though I have this anxiety at work, I deeply and completely accept myself. So you might say that whole phrase, or you might just say, my anxiety at work. Go to the top of the head. Tap, my anxiety at work. Come to the eyebrow. Tap, my anxiety at work. Go to the side of the eye. Tap, my anxiety at work. Under the eye, my anxiety at work. At the nose, my anxiety at work. The chin, my anxiety at work. Inside of the collarbone, my anxiety at work. I can go to either rib. My anxiety at work. So you tap while you're repeating the problem or the entire phrase. And then we go back and we test our intensity again. On a 0 to 10 scale, how is my anxiety right now? I'm going to say a 7. So I was a 9, and right now I'm feeling like I'm a 7. So realistically, we should be able to anticipate achieving about a 2-point drop. So you might repeat this one more time if you haven't dropped, or if you've only dropped 1 point. You could repeat this until you find yourself dropping 2 points, or you could repeat this until you get yourself to about a 2 out of a 10 or lower. It probably depends on how intense you're feeling, how much time you have, but that's what we anticipate using the 0 to 10 scale. Now I've said I'm about a 7 out of a 10. I think I'm going to do this again. I would recommend at least 2 rounds. And if you choose to do more, it depends on you and your time. So here's our 5 steps. The issue. I might change my issue, or in this case, because I want to lower my issue even further, I'm going to keep my same phrase. So my example here is my anxiety at work. So I've chosen my issue. I'm at a 7 out of 10 on the intensity scale. My setup, I'm acknowledging, I'm accepting, I have my phrase. The sequence, starting on, I'm going to do the other hand this time, the karate chop point. My anxiety at work, top of head. My anxiety at work, eyebrow. My anxiety at work, side of eye. My anxiety at work, under eye. My anxiety at work, under nose. My anxiety at work, chin. My anxiety at work, collarbone. My anxiety at work, arm. My anxiety at work. Now I'm going to reassess. Where am I at on my 0 to 10 scale? I'm about a 4 right now. I feel comfortable with where I'm at. I'm going to pick up and go back with my shift, my day, whatever I was doing. And I'm going to use the emotional freedom technique whenever I feel I need to, whenever I feel a sense of overwhelm, whenever a moment gets to be too much. This can be something that you complete in 30 seconds. So my suggestion would be to practice, to get familiar with it, to try to not be too forceful with it. And if you're not feeling what you would assume you should feel or could feel, or you're shoulding and anticipating things, walk away from it for a little bit and just allow yourself to be authentic about what you're feeling. Find compassion and find grace in accepting where you are in a given moment. There are some additional references that are listed here at the bottom of some of these slides. There are references for where you can find more information on the emotional freedom technique. I just took one version, one recommended style. Like many things, some people put their own flavor or spin on a particular technique, or they might add a title, and sometimes there are 10 points that you're tapping. This is 9 points. So I hope you find some benefit from exploring this option. I hope that you recognize that you are in need of being validated for how you feel. and that people look to you as a source of strength and guidance. And you have to remember that you are doing your best that you can, and your best is good enough. I thank you for your time.